Good morning. We're going to go ahead and initiate this assessment on the neurological system this morning. We're going to go ahead and begin by testing the cranial nerves. There are 12 in total. We're going to go ahead and start with cranial nerve 1. This is the olfactory nerve that we'll be testing, so we want to ask the patient to go ahead and close their eyes. And we're going to go ahead and place some substance underneath their nose and then ask them to identify it. So he just mentioned coffee, and that is correct. You can use 2 or 3 different substances, another one just like mint, something with a strong odor so that they can decipher it. Moving on to cranial nerve number 2, this is the optic nerve that we are going to be testing. Basically, we want to know if the patient's brain is working as far as understanding what it is they're seeing, communicating it to the brain, and actually integrating it so that they know and so that they can use the brain to actually understand what it is that they're seeing. So we have in the past performed this test, and we used a Snellen chart just like this one here, but there is also a handheld vision chart called the Rosenbaum chart. You can use either one of those, asking them to hold a paper up to their eyes in order for them to decipher with each eye what it is that they're seeing, reading the lines across, and trying not to use the same pattern so that they don't recall what they've been reading in the past. We won't go over that this time because we've already done that in the past. We'll go over a couple of other ones really quickly just to kind of recall that. So we're going to ask him to go ahead and cover one eye, and then we're going to go ahead and ask him whenever he sees our fingers come into his side of gaze, into his perceptual vision. So we're going to ask him here.
See it. See it. See it.
And we're going to go ahead and repeat that on the other side as well. Then we're going to go ahead and ask him to tell us if he tell us how many fingers he sees, just by keeping his eyes on our nose here.
1, 2, 1.
And we're going to go ahead and try that on the opposite side as well. When we completed that, we're going to go ahead and make sure that you assess the fundus of the eye, and you use your ophthalmoscope in this case, just like we did last time. And we're going to go ahead and begin from far away from the patient, making sure we visualize that pupil, and then we're going to go ahead and come in and then visualize that fundus, making sure we see that retina, and then assessing the rest of the fundus, just like we did in the last video of the eyes. So after you've completed that, you're going to go ahead and move into cranial nerves 3, 4, and 6, which test eye movement. That's why they put all those together. You have the oculomotor, which is the first one, and that one basically controls the eyelids and also some eye movement. But first, when you take a look at the patient, you want to make sure that his eyelids are not drooping over his pupils. And then we're going to go ahead and go into the, you want to test out the 6 cardinal points of gaze. So we'll go ahead and do that. Ask him to take a look at your finger and follow it. So you go 1, 2, 3, 4, 5, and 6. And then you're going to want him to actually just keep staring at your finger and follow it inward. Okay? And then you're going to go ahead and ask him to continue to look at your finger, and then look away at something different other than your finger, and then look at your finger, and then look away at something afar, and then look at your finger. And you should be seeing the pupils dilate and constrict as you're doing this. Afterwards, you're going to go ahead and, in this case, we'll keep the light on, but you want to turn off the light, and then you're going to go ahead and shine a light in one eye, and then you'll see it constrict. But you're not only looking at that eye, but you're also looking at the other one, making sure that it also constricts. So this would be direct pupil constriction. And then again, when we look at it again, we'll see concentric pupil constriction. So those are the things that you want to look for in cranial nerves 3, 4, and 6. When we were asking him to look afar and then look again on her finger, we were testing accommodation, making sure that he can change his visual field and be able to focus on different things quickly. And so we just assessed the ocular motor, we assessed the trochlear and the abducens eye muscles when we were doing the 6 cardinal points of gaze. So the next thing we're going to be assessing is cranial nerve number 5, which is the trigeminal nerve. In this one, we're actually assessing the face. I'm sorry, we're not assessing the face quite yet. We're assessing the masseter and temporalis muscles. So in this one, we're going to go ahead and place our fingers right anteriorly to the tragus nerve and asking him to clench down. And again, we're making sure that the cranial nerves that run through here are intact so that he is able to clench down and actually provide that signal to those muscles for them to actually clench. So the next thing we want to test out is you want to use something sharp, and you also want to use something like a cotton ball to assess if the feeling is intact. So we're going to go ahead and ask our patient to go ahead and close his eyes, and then we are going to ask him to tell us whenever he actually feels us feel something on his face, and tell us whether it is soft or if it is pinpoint. Softer. He said soft. Okay. So you want to check all the different sides of the face to make sure that those are intact and that he feels whether it is soft, if you're touching with the cotton, or if it's pointy and you're touching with something that's sharp. Then once you're done doing that one, we're going to go ahead and ask him to just kind of let his jaw loose. And what we're going to do is you're going to put your finger jaw loose, not open, jaw loose. Jaw loose. So you're going to put your finger here, and then you're going to slightly tap. And what you're testing for is to make sure that he doesn't have a jaw reflex to where it moves and closes shut. We're going to go ahead and stop there. We'll continue the next video with cranial nerve number 7.